Hi, my name is Maggie Dancy, and I'm in the Neonatal NP program. For this presentation, I will be examining maternal mortality ratios from the World Health Organization between the United States and the Democratic Republic of Congo. 94% of all maternal deaths occur in low and lower middle income countries. In 2017, 86% of global maternal deaths were in sub-Saharan Africa and in Southern Asia. I selected the US because they have one of the lowest maternal mortality rates to compare to the Congo, which has one of the highest mortality rates. As you can see on the map, the maternal mortality rates in the US is somewhere between 1 to 19 deaths per 100,000 live births, and the Congo is between 500 and 999 deaths per 100,000 live births. These ratios do not account for deaths associated with stillbirths and abortions. Some of the acute causes of maternal mortality include severe bleeding, like post-delivery hemorrhages, pre- or post-delivery infections, high blood pressure during pregnancy, known as preeclampsia or eclampsia, which can be fatal, complications from delivery, and unsafe abortions, not accounted for in the data but is a cause of maternal mortality. Many of these issues can be prevented or the severity can be decreased through prenatal or antenatal care and having a skilled birth attendant at delivery and during postpartum care. This led me to explore more of the maps on the WHO's website. There is a map for antenatal care coverage, which is measured in at least 4 visits to a medical professional during pregnancy. The map showed that 92% of American women received these 4 visits, while only 48% of pregnant women in the Congo received these 4 visits. Some of the major reasons women do not receive antenatal care include poverty, lack of information, culture, inadequate services available, and distance to facilities. These reasons are more prevalent in lower income countries like the Congo than in higher income countries like the US. I then examined percentage of births that had a skilled personnel present. This includes a doctor, nurse, or midwife. The US, all the way to the right, the green dot circled, reached nearly 100% of all deliveries having a skilled birth attendant present. The Congo, the blue dot just to its left, reached 80%. I found this interesting because this gap is not nearly as large as the gap in maternal mortality rates between the countries. Therefore, I searched the WHO website for nursing and midwifery personnel in each country to represent the availability of prenatal and postpartum care for mothers. Here's the data that shows that the US has 10 times more nursing and midwifery personnel than the Congo. Nursing and midwifery follow pregnancies from start to finish and postpartum for at least a month after delivery. Many of the issues that cause maternal mortality, like hypertension and infection, show up in the prenatal and postnatal period, not just in the intrapartum period of delivery that is covered by the skilled personnel. When examining maternal mortality, it is important to see how this impacts infant mortality. The US on average has 3.5 deaths per 1,000 live births, versus the Congo has about 28.3 deaths per 1,000 live births. This data is comparable to maternal mortality ratios between these countries. Of the causes of death, the WHO notes of neonates, intrapartum-related complications, neonatal sepsis, and prematurity can be prevented through the same ways maternal mortality causes can. This means up to 36% of causes of neonatal deaths could be prevented from maternal health interventions. So what can be done to help decrease maternal mortality? The following interventions could have the potential to decrease the rates. First of all, greater access to family planning decreases the incidence of abortion and unplanned pregnancies. Secondly, early detection of hypertension through prenatal care can improve maternal and neonatal outcomes. Prenatal care can cover other topics such as substance abuse, diet education, and birth information, which also can improve maternal and neonatal outcomes. Next, if every delivery is attended by a skilled birth attendant, both mother and baby would have support through birth. Additionally, women should have access to obstetric care if birth complications arise. Lastly, more nurses and midwifery availability would increase prenatal and postpartum care through the first month after delivery, monitoring mothers for post-delivery complications like infection. Thank you for exploring maternal mortality ratios between the United States and the Congo. No matter the ratio, this is an issue that needs to continually be tackled across the globe. If you have any questions, let me know. Thank you.